august gathering of doctors and healthcare professionals from across India. COVID-19 is not a health crisis alone. It is fast evolving into a broader and tragic child rights crisis. The pandemic has wrought havoc on entire communities and families, and children are its hidden victims. Their health, education, physical, and mental well being are being threatened. If we do not act now, the lives of an entire generation will be at stake. Although the number of children getting the virus has increased with rising cases, thankfully, most cases are mild. Concerns remain, of course, about children's health in future waves, especially as children are not vaccinated. Now, the indirect impact of the disease on children and women's health can be more severe and long lasting. By causing a huge stress on health systems, the pandemic threatens to reverse some of the steady progress that India has made in newborn mortality reduction over the past 5 years. Estimates are also pointing to the possibility of a rise in child malnutrition and its related mortality and morbidity, and also the concerns around food insecurity. When children themselves are not ill, some of them have lost parents and sole caregivers to the pandemic, leaving them in a precarious situation without parental care. These children are not only living an emotional tragedy, they are at high risk of neglect, abuse, and exploitation. The knock-on effect of the pandemic on children and women in all spheres of life is more severe at times than the direct impact of the disease. Closure of schools translates in loss in access to education for over 280 million children in pre-primary to secondary levels, half of them whom are girls. Remote learning as the only viable option available to children to continue their education is also not without challenges. A 2020 UNICEF study in 6 states among 10,000 adolescents found that only 60% of the students use any form of remote learning or online resource. 80% of them feel that they are learning significantly less than when they go to school, when they are there physically. Digital channels are not as accessible as perceived. 10% of students overall do not have access to a smartphone or an internet device. Since 2020, many families saw their livelihoods collapse as millions saw their jobs being lost. 3/4 of the workers were in the informal sector. The economic distress combined with school closures could lead to families resorting to negative coping mechanisms such as child labor, child marriage, and trafficking of children. The distress among children is evident from the fact that Childline received 460,000 calls in 21 days at the beginning of the pandemic in March to April 2020. And they were asking for protection from distress, from abuse and violence. And there was a 50% increase from their regular call volumes. Nearly 10,000 of these needed intervention and support by our Childline support staff. Normal life as known by children has changed, given rise to issues related to mental stress, confusion, anxiety among children and teenagers. Parents too are stressed, and that is contributing to an increased violence sometimes at home, with women and children bearing the brunt. If not appropriately addressed, the mental health consequences for a generation of children and young people could be larger than the health and economic impact. So the impact of the pandemic on children are immediate, and if unaddressed, may persist throughout children's lives, affecting their ability to reach their full potential, something we are all geared towards supporting them in. Which means we need to join forces and act now, working with partners, donors, and governments to ensure our emergency response, that critical supplies reach the most vulnerable communities, along with the accurate preventive information. UNICEF is prioritizing the delivery of life-saving supplies and vaccines at this difficult time. We are proud to have supported the government in procuring 8,000 oxygen concentrators, close to 300 RT-PCR testing machines, and those have been delivered. 74 mass thermal scanners and 8.5 million triple-layered masks and 1.75 million face shields and personal protective equipment have also been distributed. UNICEF has supplied cold chain equipment to augment nearly 1,400 cold chain points in 523 districts across India. We collaborate with the Government of India and partners through extensive risk communication and community engagement. This is really to tackle misinformation and spread awareness among communities with important information on the disease, its preventive actions, such as COVID-appropriate behavior and vaccination. We have responded to the learning crisis, focusing on the immediate needs to design innovative education solutions and support parents to enable remote learning. For example, UNICEF is providing technical support to government and partners to help about over 12 million children in 17 states continue learning from home. In Bihar, the mobile learning centers are helping 28,000 children who did not have access to any type of digital equipment to continue their learning. 7,000 community volunteers, who we call Sikh Mitras, in Chhattisgarh are reaching out to more than 60,000 children and parents to bridge that digital divide and support children's learning, armed with teaching and learning materials. UNICEF, in close collaboration with partners, has supported more than 4 lakh children, parents, and caregivers in 17 states with mental health interventions. More than 10,000 frontline workers, of whom about 44% are women, from childline CSOs and childcare institutes, have been trained on providing psychosocial first aid to children. Moving beyond immediate emergency needs, we have focused on sustaining recovery. This includes scaling up of low-tech and no-tech solutions as blended learning opportunities and safe return to school for all children when they are open. But we also focus on protecting the most vulnerable children for violence and abuse, especially girls, and children with disability. We advocate for essential services for migrant children and financial safety nets for vulnerable families. In partnership with the government and other institutions, support of maternal and child health care to the most vulnerable and to rejuvenate routine immunization is core to our agenda. UNICEF has also strengthened water, sanitation, and hygiene and infection prevention control protocols and practices through support to 256 facilities in 50 districts across 24 states. Finally, learning from the pandemic can guide us to reimagine how to protect future generations from facing this kind of a crisis. It would need for governments across the world to scale up investments and commit to quality and affordable and accessible healthcare, to protect, promote, and support good nutrition for all, to have a greater investment in sustainable, climate-sensitive water, sanitation, and hygiene services, to invest equitably in quality education and skill development, to access key social services and mental health support for communities, to invest in inclusive, child-focused social protection systems, such as universal child grants, and to ensure equal opportunity for every child. Finally, the role of the community is crucial in this, and we all have to look at ways of improving their agency and for them to be able to take greater control over their environment. Thank you so much for listening, and thank you for inviting me to this wonderful event.
Thank you so very much, ma'am. You very rightly mentioned that society needs to come together as a whole and create a change. It's been a pleasure listening to you. Thank you for sharing UNICEF's plan when it comes to mitigating the pandemic and how children can really benefit from it. Thank you once again for joining us. We are now all set to bring to you our next session, which is on Doctor's Perspective, Going forward, what lessons we learned from COVID-19? We are now being joined by Dr. Ambrish Mittal, Padma Bhushan, and Dr. B.C. Roy, National Award recipient, Chairman and Head, Max Institute of Endocrinology and Diabetes, Max Healthcare. We welcome you, sir.